I started with hypertension, high blood pressure because of the story with my
Yep.
aunt. I was like, okay, let's start with the basics. And then I was like, okay, let's talk about diabetes. Again, this is very, very common within my community
Mm.
and the people I was serving at the time. And then we touched on sickle cell disease, sickle cell anemia, again, quite prominent in the African and Caribbean communities, but even in South Asian communities and so on. And then eventually people did say, oh, no, actually, we want to know a little bit more about cancer, or they would suggest certain topics.
Hello, and welcome to the Thrive Against Cancer podcast, where we give a voice to the cancer community. My name is Toby Freeman, founder and CEO of the Robin Cancer Trust, cancer advocate, and your host. Every episode, we will be hosting open and honest conversations with people affected by cancer, whether personally, as a family member, clinician, or charities and organisations. We will be talking to the cancer community about the cancer community and all the things that are important to you. Our guest today is an award-winning GP, educator, honorary senior clinical lecturer and medical broadcaster, celebrated for her contributions to health education, awareness and advocacy. She empowers audiences with evidence-based health information focusing on women's health, cancer awareness, mental health and health inequality. Our guest today is Dr. Aziza Sesay. Thank you so much for being here.
Thank you so much for having me and the introduction.
Well written. I do receive them in advance, so much appreciated. Usually on the podcast, we're talking to someone that might be going through cancer or has gone through cancer. So we say, like, let's begin at the beginning, and that's, pre-diagnosis. But in your case, I think in your role and what you do, all the advocacy work, all that stuff I've just introed, I'd love to know what sparked in you the moment where you're like, I am going to start broadcasting this out to the world. What was that moment for you?
I have a key moment, actually. This is a story that I share often. Obviously, as a GP, I am going to be seeing patients. I see them, I diagnose them, from the suspicion to managing them all the way through. So I have the passion and the insight for that. But in terms of educating the masses, that actually came because of COVID. I was having a chat with one of my aunts, and she very excitedly told me that her blood pressure was normal. I was like, oh, this is great. And she's like, yeah, so I stopped taking my blood pressure tablet. And I was like, oh, no, oh my gosh. So she didn't realize. And it, hit me that actually quite a few people don't know even the basics of health in general. So it started off with that, but I've always had a passion about cancer. I've been touched by cancer personally within my family and obviously the patients that I've managed over time. There's just a lot of myths, misinformation, disinformation. There are loads of fad health fixes, cures, and there's so many people who unfortunately are suffering and they're sadly dying younger than they should do. And some of it is to do with the lack of awareness. Yes, the misinformation is there, but just the lack of general awareness about what symptoms are to look out for and when you need to see the doctor. Also knowing that you can advocate for yourself and push for things, because a lot of the times, particularly within my community, so you mentioned I do a lot of health inequity. I do, because within my community as a Black woman, sadly, we are often dismissed and not listened to. And then we have diagnoses late, which means that we have worse outcomes. So I just want the information to be out there. And if it means that one person watches it and it changes or potentially saves their lives, it's worth it.
Yeah, couldn't agree more. And I think it's such an important role, the GP role as well, because actually just the fact that a GP is doing it, it's usually such a stumbling block. As you say, your general practitioners, right? You see a swathe of different things, and cancer comes in all shapes and forms. And actually quite often there are cancers that you may never see in a career or once or twice. And actually having someone as that primary care that you go to see, breaking that down, I think that really helps reduce that stigma, reduce that embarrassment. And I'm sure we can dive into a lot of that. Just what you were saying there, I was like, oh, that's the whole podcast. That's everything we want to talk about. And maybe we can just tick through them at this
Sorry.
point. No, that's fine. I love it. Love the passion. So yeah, I mean, that's amazing. That story you said. Let's start with, what was the first platform? When you said, right, this is a big issue, I need to talk about this. Where did you go to? What was the...
So I was already doing community talks for my local community, just community health talks for local women's group. And sadly, because of COVID at the time, lockdown meant that I couldn't do it. But then everybody was Zooming. Zoom was a thing. So I started doing live Zoom talks for free. And then I realized that actually it means that anyone from anywhere can access these talks, because I had people, because I grew up in Saudi Arabia and I'm originally from Sierra Leone. So people from Saudi, from Sierra Leone, friends from Dubai and the States and so on, loads of people were tuning in. And I realized I could make this accessible to everyone. So that's when I started my Instagram page. And it was just like a little, I guess, channel for people to see that it even exists and that they can access this for free. Again, my way of giving back. I was doing this every fortnight at the time. I only had one kid then. That's why it was possible. And it was lockdown. So, and then I had a few people say to me, "Oh, Aziza, we can't always link at the same time as you because of the time difference. Why don't you record them and drop them on YouTube?" And then I created my YouTube channel. So all of that was going really smoothly. And I felt like I was really making a difference, talking about diabetes to hypertension, high blood pressure, to cervical cancer screening, cancer screening in general, sickle cell, so on and so forth. And then I got pregnant during lockdown because that's what a lot of people were doing at the time. I'm one of those statistics. And then I couldn't do the talks as much anymore. And actually, that's what birthed the little videos. So if you come across my page on socials, I'm Talks with Dr. Sesay. I do a lot of really fun, engaging videos just to capture your attention, using trending music often to I guess confuse you or distract you from the fact that I'm actually teaching you something that is important and life-saving. So really that's been my trajectory, and I've been very, very fortunate that through that I've worked with loads of incredible charities, and now obviously it's meant that I've gotten to meet you and the incredible charity that you're running, literally running. So yeah.
That's amazing. And those topics, were you being led by the people asking questions, or were you just at the beginning picking things, going, right, I've heard this in my career, people need to know this. I imagine you might have had a list of 100 things and you were just going through them. Is that how or were you getting people going, can you talk about this? Or or in my country, people don't talk about this certain issue. Because you mentioned some countries there as well where conversations, especially, around women's health and cancer awareness, might be much more taboo, a load of stigma there that you need to break down.
Absolutely. Such a great question. Actually, I started with hypertension, high blood pressure because of the story with my aunt. I was like, okay, let's start with the basics. And I was like, okay, let's talk about diabetes. Again, this is very, very common within my community and the people I was serving at the time. And then we touched on sickle cell disease, sickle cell anemia, again, quite prominent in the African and Caribbean communities. But even in South Asian communities and so on. And then eventually people did say, oh, no, actually, we want to know a little bit more about cancer, or they would suggest certain topics. And one thing that I felt very strongly about was the cancer screening, because sadly, again, within my community, loads of marginalized communities, they don't often partake in screening. One, because they don't understand why it's even important. Two, there's a lot of distrust within the medical platform because of what's happened in the past, being used and misused and so on. So some people feel like, oh, no, I'm not going to give them my cells to store. And I've had to sort of debunk that and try and build the trust and showcase why it's important. And I love that you touched on the fact that, yes, again, stigma and shame around certain topics. I do a lot of women's health. And in fact, it sort of veered more towards women's health. And I guess I focus a lot more on women's health. I do the general health awareness as well, but my main niche right now is women's health, and is because of that. There is so much shame, so much stigma surrounding it. And I have seen within my job, but also through my family, my friends, people who are suffering, and often loads of women who are suffering in silence, because one, they don't come forward about their issues because they're embarrassed, and two, it's just not spoken about enough. I've had many people say, for instance, one of my good friends, she didn't know anything about endometriosis. She's in her late 30s, and that's when she got diagnosed with endometriosis, because she realized, oh, so these symptoms weren't normal. I didn't need to put up with it. So there is something that I can do about it. And it's those little things that make such a massive difference. Similarly, and I'll share this story. I had a patient, this is going back years, who young lady came in about something else, felt comfortable to talk to me, and then told me that she'd been struggling with itching in her vulval area with discharge. And, it sounded like thrush immediately. So I gave her treatment at the time. And this at the time you could book appointments more with GP. She actually booked an appointment not because she had another problem, but to thank me, because it almost felt like I gave her life back. Literally, she felt like, oh my God, I didn't realize that something so simple can be given to treat this issue that I've been having for months. She wasn't leaving the house. She wasn't doing certain day-to-day activities. Her social life was affected. And that's not an unusual story. And because we're talking about cancer, this again, this is why I'm really big on cancer awareness, and I carry around little props like this. So a little, what is this? What do you think
Well,
this
that's
is?
a vulva. I mean, it's
Yes.
female reproductive area, but yes, that was a vulva.
Thank you. Thank you. You did not
I
say
watched the
vagina.
videos. I watched the videos.
You watched the video. So many people say vagina, which it's fine because then they get the education. But even around that, and the reason I just showed that is because I had a patient last year, an older lady who was struggling with excruciating pain in her vulva, excruciating. And then when I examined her, she had like the biggest lump that you could ever envisage in that area. So that meant that she must have had this lump for a very, very long time. And the only reason she came in was because she was in agony. Sadly, I looked at it, I knew it had to be cancer. I referred her, she got diagnosed with cancer. Sadly, she has passed away a couple of months after the diagnosis. And that could have been prevented if we remove the shame, the stigma, the taboo that's associated. And that's why I often say that women are literally dying of embarrassment, and that should not happen.
Not at all. And it's so powerful. A lot of things you've talked on there. We've heard in previous podcast episodes, generally from young women, finding it hard to get diagnosed anyway, especially by male doctors. The shame as well, the stigma, so powerful that we've found through our conversations with other people in the community. The big thing is people from those communities talking to people from those communities. It's very different. Let's use this as an example. Me going in and talking to a community of, Black women about a vulva is very different with, as you said, layers of mistrust, historical issues with, doctors, and that goes back generations and generations to you advocating not only as a Black woman yourself, but as a doctor. That is so powerful that people can see people that represent them and talking about it in a way that they understand as well. Because that is, that's the normalization. Because it's those conversations, the peer-to-peer conversations that aren't happening is where the stigma and the shame come from.
Absolutely. Thank you so much. And you're right, because I have had so many people share messages on my platform or send me comments, and they say things like, wow, first of all, like, if you notice, this is a brown vulva. So
yeah, of course.
that, oh my God, it's a brown vulva. I've never seen a brown vulva before. So I paid attention. Or, I've seen a Black doctor and I'm paying attention. I'm not saying that that's how things should be. It's just that representation really does matter. And sometimes that's what helps with the trust. As you say, trust had been broken in the past. And a quote that I've heard, I've forgotten his name now, but he says it a lot, but it's the truth. Trust comes in footsteps, but it leaves in hooves. It just goes, and it takes a really, 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 really long time to rebuild it. And this is where I really advocate for grassroots organizations, why I support loads of grassroots organizations, because you have the trust of your community. You have the know-how, you know how to approach them, and you know how to have the conversations in a way that they will take in the information. So yes, representation is absolutely crucial and important. If you can't see it, you won't be it, or you don't realize that actually that can pertain to you. But also having the people, like you say, peer to peer, that you can trust, that you can relate to. That also helps.
Yeah, and that's that generational stigma you're trying to break down, isn't it? You can only start with the people you can talk to, but you hope it seeps through conversations in families and starts to normalize over time. And actually, I imagine from your side as a doctor, it'd be really interesting to hear how you feel about medical representation as well, like textbooks and imagery. And, is there, I know this has been a big conversation, but do you still see that there is a lack of representation from because a general practitioner, you see everything, but if you're only seeing white people represented in your textbooks, in your anatomies, in, the pictures, that's going to be harder to diagnose as well.
Absolutely. Like you could not have said it any better. And I can tell you that in medical school, it was like that. My textbooks, it was always the same sort of skin tone that was represented. So when I think about eczema, which is a great example, I think about someone who has obviously the fair skin, and then the eczema patches are red, inflamed, and angry. But that's not how it looks on brown skin, especially if you're dark skin. It can look white, or the skin looks thickened. It may be the same color. It can even look darker. But if we don't have that education, how would we know? And this is an issue. But I have to say that over the last at least 5 years, things have improved. There are incredible pages that are out there, loads of amazing platforms, dermatologists who are working really hard to change the narrative. There's someone called Dr. Sharon Belmo. She does so much work on Black dermatology. There's Black Skin Directory. There's Black Derm page on Instagram as well. And then I think, is it Hugh Tono? There's a medical student who also created a book called Mind the Gap with loads of different representation. It makes a massive difference, because if we can't see it, then we don't know what it's supposed to look like. And this is where you get the delayed diagnosis or incorrect diagnosis. And then you have people who are suffering and, being moved from pillar to post before finally somebody who has the experience and the education or who has been able to see it makes a diagnosis. And that is why I'm really big. Like I have so many different props here. I have my breast blushie, which is brown. I have my other vulva model, which is brown. I also have, I don't know where I put the penis, but I do have a crochet penis that's also brown. And I'm not saying that we shouldn't have the other representation. It's just that we don't have enough of this. And that's why I make it a big deal of showing you what's out there. And I have a couple of popular videos on how to check your vulva. And again, I always show it brown, because in my mind, I'm like, okay, well, I'm going to show you how I check my vulva. I'll show you a vulva that looks similar to mine. Do you know what I mean? So I completely agree that this is so important. It needs to be better, and things are improving, but it's a shame that it's honestly taken like literally the last 5 years. I mean, if I'm being really generous, then maybe 7, I wouldn't even say decade. It's still an issue that needs improving.
And that is one of the, I say this all the time on the podcast because we have a lot of people that are very active on social, but it is one of the best things about social media, right? Is that ability to broadcast at a large scale. It can be shared. It can be sent directly to people. It can be sent privately as well, which is something that I think is really powerful, and probably something that you cannot track in your metrics, but that stigma breaking, that embarrassment breaking. You can send someone a quick DM. It might be a mother to a daughter, and how powerful could that be? So thank you for all that amazing work. And actually, you sit at a really interesting and amazing sort of intersection of charity and the clinical side, because you are the vice chair and creative director of Black Female Doctors UK as well. So that must be an amazing piece of advocacy work on the medical side. And then you're also an ambassador for Eve Appeal and Wellbeing of Women. So just talk to me about those roles and what you're like really passionate about driving forwards.
Of course. Okay, so in terms of the Black Female Doctors UK, that organization exists basically to unite, excel, and empower other Black doctors, Black female doctors. Because I'll be honest, growing up, I did not have that representation. Even as a medical student, there weren't that many Black female doctors who I could visualize, who I could see or want to become. There were not that many of us. And even across just looking, there weren't, again, many Black female doctor colleagues around. And the honest truth is there's certain nuances, there's certain experiences that we go through that we can relate by having discussions with one another. When you talk about the peer discussions and having that safe space to feel seen and feel empowered and feel like you do belong, it is a problem that not many people are brave enough to speak up about. So even having different hairstyles, like I have braids and I wear braids, even though I think they've changed this now, but if you Google professional hairstyles or unprofessional hairstyles, braids are one of them. Yeah. So and that is sadly that is to do with yeah, that's a bit, but that's another conversation. That's racism in a nutshell. But I've had personal experiences where I've been to patients' houses and I've had my braids. I remember this isn't a very nice experience, but I want people to understand that we do go through this as Black female doctors. I had my hair in a bun, but it was braided. And just because of the way that looked to the patient's relative, she didn't want me to see her mom when I went on a home visit. In fact, she kicked me out of the house. Which wasn't a very nice experience. But these are things that a lot of us have gone through. And we know that there's what's called differential attainment. Again, Black doctors don't often reach senior positions, and we usually have many barriers before we get there. And there are many more negative experiences. And I don't want to make this podcast about that, but I want you to understand why that is why the organization exists. It just gives that safe space so that we can all really support one another and talk through things and build that resilience to keep going and encouraging one another that it's actually not that bad. And we are needed in this space, particularly to help support more and more of our patients who, like you say, when I have Black patients come in, sometimes you can see that the ease sometimes, and that can be based on past experience that they may have had, and that's not always the case. I know of many incredible doctors out there of many different ethnicities, but that's why the organization exists, and we have events. We even had an award ceremony a couple of years ago, which hopefully we'll do that again, just to credit and award all women in healthcare. Because again, women in general, we're underserved and underrecognized, underappreciated. So especially in healthcare. So we wanted to create something positive in that regard. So that was the Cura Award. But as you say, I'm very, very fortunate to work with loads of different charities. So yeah, I'm an ambassador for the Eve Appeal. So they are the UK's leading gynecological cancer charity. Again, I'm really big on cancer, especially gynae cancer, because the outcomes there are really, really sad. And again, because of the shame and stigma associated, people don't actually like to talk about the fact that they're diagnosed with, for instance, vaginal cancer or vulval cancer. Like if someone asks, like, oh, I have cancer, and they won't explain where, because there's often that stigma that you might have caused it. There's someone, Karen Hobbs, who often shares her story. She's a comedian. She's an ambassador for the Eve Appeal. And she said when she told people that she had cervical cancer, their response was, oh, how did you get that? What did you do? Rather than, oh, I'm so sorry to hear, because of the area. And we talk about social media, and I'm sure we'll talk about censorship at some point, but we get censored a lot. I get censored a lot. I get shadow banned where my post doesn't get shown to anyone. I've had quite a few people message me. They're like, oh, Aziza, where are you? I haven't seen you. I'm like, I am on socials. There are videos there, but it doesn't get amplified because it's seen as inappropriate, pornographic. And so what happens is there was a hashtag vaginal cancer, and that was hidden because it was seen as inappropriate. And the saddest thing was, I think it was a post that the Eve Appeal shared, and this lady bravely shared her story about vaginal cancer, and we hashtag vaginal cancer, and it was hidden. And it took a lot of rallying before they undid that. But why is that the definite, like the root, the immediate root? Why is it always seen that way? And it's still this way. And it's something we're trying to fight against. I also am ambassador for Wellbeing of Women, again, another women's health charity, Endometriosis Foundation. And I'm very lucky to be an ambassador for the Hatfield Vision, which is part of the College of Sexual Reproductive Health, again, to try and improve outcomes in women and girls, and also improve the health inequity that exists in sexual and reproductive health. Yeah.
You must be so busy. That's quite a lot. Again, so much to unpick there. I do literally have a note here that just says words matter. And for that, we can dive into that, talking about specific, saying vulva, saying vagina, and the impact on social media. I'd love to dive into that. But just going back a couple of steps, it is so important when you're talking about representation, just as you did say, from the cancer patient, from our side here on the podcast, for them being represented, you need that at all points in healthcare. That is so important, from the top all the way down, from women, women of all different, ethnicities need to be there because the cancer patients need to see them. They need to be advocated for at all points. So thank you for all the work you're doing. It's there was more things than I even had written down. You kept adding. I'm an ambassador for even more and even more. It's
Thank you.
Brilliant. But yeah, that the words matter thing is so important. I know you've done a lot of work on this, and against, you're fighting against the tide of censorship on this. But there have been some strides. I mean, because I think at some point you could say that social media would completely get rid of all these things. But actually, you've been on TV, you've talked about these things. There has been amplification in a really positive way about these really taboo subjects, and that must have been amazing to fight against that. The censorship, the shadow banning, which must be soul destroying when you're just trying to put some good out in the world on a platform that is known for disinformation. And I'd love to get your thoughts on disinformation and how you go about trying to, not just put the right stuff out, but not amplify, but say this is actually wrong as well. It's that balance, isn't it? But yeah, talk about, I'd love to hear some of the great things that have gone on and some of the people that have helped you amplify it on a national scale, because I think it is important.
Thank you so much. So when you talk about TV, actually, it was BBC Breakfast, and this was a couple of years ago when we were talking about cervical screening awareness. And I just said, I'm going to bring my props. I didn't tell them what props I was bringing. And I did bring my vulva, and they were okay with it, even though it was breakfast. It was early in the morning. And I believe someone told me this just before I went on. They're like, oh, you know that they have 6 million viewers every single day. I was like, 6 million? Wow, that's incredible. 6 million people are going to learn about cervical screening, and hopefully they actually partake in it. But it was incredible. That was probably one of the highlights of my careers at that moment, because the presenters were unfazed. And actually, I had the other models there. I had the model of the internal gynae anatomy, and I pointed to, it's John Kay. I pointed to him. I was like, do you know what this is? And he's like, oh, of course, you're going to ask me. And he took it really well. And then he took pictures of my little props and then posted it on BBC Breakfast and invited them as collaborators. So it was there on BBC Breakfast, a brown vulva, and then the other internal gynecological and anatomical structures. I was blown away. I was so happy. I was so happy. And we said the words, and it was okay, and nobody got hurt, because they're just words. They're not bad words. So that was incredible. And I've been very fortunate to be on BBC Morning Live as well. And again, I've spoken about UTIs, and I said vulva, I said vagina during that. Again, no one batted an eyelid, because at the end of the day, these are conversations that we should be having, because ultimately you have people, again, who are suffering in silence, or who aren't even aware of the basics, because we're not taught it. We don't speak about it, and we're taught that, this is something shameful and what needs to be embarrassed about, which shouldn't be the case. So that's been really incredible. Yes, I hear you. There are positive strides on social media, in that, yes, you are able to post certain things, but actually I would say that things seem to be getting a little bit worse.
Oh, really?
Because there's some bigger doctor pages who have found recently that they they definitely have to censor themselves in order to get that amplification. And it's gotten much, much worse. And the algorithm knows what it's doing, because you might have, I don't know, 100,000 views on a post about something else, and then you say the word vagina, vulva, clitoris, or you spell it correctly, or it hears it, then you have 1 or 2 views, or it just removes it. I had a video where I was talking about the internal structure, the clitoral complex, the whole clitoral complex, and how I have a glow in the dark one, because when they do an MRI scan and there's an engorged clitoris, it looks like a glow in the dark. So it was kind of like a jokey thing, but trying to teach about the anatomy internally. That post got removed from TikTok because they're like, it's inappropriate, but I had to appeal, and after a couple of appeals they brought it back, but it has like 2 views because it's not allowing it to be amplified. And the interesting thing is that the misinformation posts seem to be amplified. Those are the ones that do really, really well, like the most extreme, or I guess the most hyperbolic posts out there. They're the ones that seem to be amplified, and they do better. which is heartbreaking. But I also noticed that inappropriate posts where women are being sexualized, those also do better. It almost feels like we don't want, or they don't want women to be educated or empowered through education, because and I've said this before, but it almost feels like they know that an educated, informed woman is harder to exploit. And that's how it feels like for me as a healthcare professional, where I am me, not just me, loads of different healthcare professionals and advocates out there who are trying to share the right, correct information, scientific evidence based, and we're just not getting that push. And it is so disheartening. It is so destroying, especially when a lot of us take so much time to create our videos. A lot of thought goes into it, and we have to look at the most recent research, and then we have to translate it in a language that everybody can understand. And that is a skill, and try to make it engaging and try to capture, like, we're really fighting hard to get the information out there that could potentially save someone's life. It shouldn't be that hard. And actually, the women's health strategy, the renewed women's health strategy, was released a couple of weeks ago, and I was invited to speak to, was asking whatever questions I wanted about how we're going to improve women's health through the strategy. And I actually did ask him about this issue we're having with the censorship and shadow banning, and he knew about it. He recognized it. He says that they're working with the people from science and technology, and that they're having the hard balance of holding those platforms accountable for the harm, the social media harm that's out there, but also trying to juggle and balance the fact that they need to also ensure that there's credible scientific evidence-based information. Like, trying to get that balance right is what they're finding hard, but they're looking into it. So fingers crossed. And I've worked with YouTube before, and I've raised this with them. I've become good friends with the head of YouTube Health, and I explained this to him, and he said, yeah, and they're trying, but it's just so hard, because how would they know which bit is actual health information and which bit is pornographic? And now we do have little ticks that shows that we are healthcare professionals, but still certain things, like for instance, this they've said is not allowed because it looks too close to human nudity, and line diagrams are better. And I'm like, but does this like, this is
crocheted. It's crocheted, man. Anyway. Like, yeah. Oh no. I mean, again, so much to unpack there, and thank you for pushing back, because obviously you see your own little social world, and perhaps I just see you guys all doing it. I'm like, that's brilliant. Like, it's just everything's rolling. But I mean, part of this is, and we're sort of getting into big issues here, but these massive media conglomerates, the YouTubes, the Instagrams, the TikToks, they're bigger than countries, aren't they? So how does a country institute something within its own domain on a platform that is hyper global, and then I suppose we're getting to an algorithm that is built on, dare I say it's all AI now, isn't it? And that AI could have inherent human error of institutional racism and misogyny built into it. And then the only times you're ever getting de-shadow banned is when a human interaction is happening. But the algorithm, like you say, has gone away from it at that point. So, I don't know. I mean, thank you for advocating for it, is all you can say. And have you done any work with the Department of Education? Because, I always think social media is this amazing platform to project, but has all these issues. Whereas actually the Department of Education is controlled in a way that you can speak to someone that is at the top of it and can filter down and is, the curriculum. Are you doing any work on the curriculum side to reach those young people at a time when they need to be reached?
Yeah. Wow. So many great things that you've just said there. I've done some videos for well-being of women, and they're hoping that they will show these videos in schools, and it will be part of the curriculum. And it's just basic information about menstrual cycles, about different anatomy, and also what to say to your doctor what consultations are like, and just to prepare them for consultations, as well as common conditions that, again, many people aren't taught about. And then they find out in their 30s that, oh, I should have known about this since I was a teenager, and I've always had this problem. So yes, in terms of that, that's where I'm supporting. I've not actually spoken directly to someone from the Department of Education, so that's probably somewhere that I need to head into and push for, because I am a massive advocate for children learning things early. I mean, my daughter, ever since she was young, it's always been called vulva. We don't use flower or, all those euphemisms. And because ultimately we know, and I always say this, and I know that I'm sure that you agree, but we know that when we start using different names, that we are encouraging that body shame and that embarrassment around the areas. And also, we're not protecting them, because we also know research has shown that sexual predators often avoid children who use the correct terminology, because it's them like, oh, they've been taught about body safety and sexuality, so I can't go to those kids. It also helps to give them the ability to articulate where their symptoms are. So my daughter will tell me exactly where she's experiencing pain in the area, because she knows all the different parts. Adults don't even know that. I have patients who say to me, I have a vaginal lump, when they mean vulval lump. And that makes a difference in how you're then treated. So it just builds the confidence. I'm like really, really big on children learning. The other thing is that we perpetuate that shameful narratives. There was a lady who told me, and I love sharing this story because it was really encouraging for me. She felt really encouraged to teach her son the correct name of his penis. And she said, oh, look, this is your penis, not, I don't know, ding dong. And then he said, oh, great, mommy, that's the real name for my penis. So what's the real name for my elbow? So we are building that. And then she's like, oh yeah, it's called elbow. But why was there a different name for my penis? You know what I mean? So it's those sort of conversations. I really, really, I hope it's okay. I want to just go back to the AI point that you made. And you're so right, because when I spoke to YouTube and I complained about that, every single time it was a human involved, it would go through, right? I wanted to work smarter, not harder. We could talk about my campaign in a minute if that's okay. But I wanted to share a newsletter to my followers, and I thought, let me use AI to help me with this. And I was like, create the post that says we're normalizing the words vagina, vulva, clitoris, and blah, blah, blah. And then when I pushed send for it to do it, it came back saying, sorry, your content goes against OpenAI policy. Yes. Whoa. And I said, okay, which one is it? So I did it again with just vagina, same thing. Vulva, the same thing. Clitoris, the same thing. Then I put penis. That one didn't go through, but testicles did.
I was
testicles was fine.
Yeah, we haven't come up against that in our work, which is so interesting.
Because testicles are fine. Testes and testicles are fine. But penis, vagina, vulva, clitoris, no, that goes against OpenAI policy. Can you believe that AI has been trained to think that genital anatomical names are inappropriate? And isn't that dangerous for future things? I remember I was curious to see what ChatGPT would say about, because I want to see what people are asking Chat the question. I think it's different now. And I said, oh, how should people wash their vagina? And it said, sorry, this goes against OpenAI. I can't respond. I was like, okay, right.
That is bonk. I mean, that is terrifying, isn't it? Especially with the younger generation, they don't even Google. They go to a ChatGPT, a Claude, or whatever the Google version AI is. They just use those. So again, it's horrendous human error, isn't it? Building
it's only
these
as good
models.
as whoever puts the information in. And if the person who puts the information in is misogynistic, racist, or whatever.
I was going to say the unfortunate truth that probably we don't want to hear is open language models reflect society, don't they? That is.
Yeah.
So.
That's true.
Yes. That'd be really interesting. I don't know who you'd hold account at OpenAI, but definitely that needs to change. I was going to ask, sorry, just before we talk about your campaign, I'd love to dive into that. Thank you for bringing up the words. I had a note on that about doctors, because that must make your job so much easier to diagnose people, which is a really important bit. And I think that's a great bit of advice for people going to the doctors is, even if it's uncomfortable for them and they haven't, use the direct word, use the anatomically correct, so a doctor can actually help you in the right way, and because you don't have a lot of time anymore. So the quicker and easier a diagnosis and a conversation can be. And maybe we can talk about some ways people can what they can do at the doctors later. The videos you created, sorry, for schools, and I think it's a really interesting one. Did you say that was just for the girls, or is that for boys as well? Because
It's for both.
oh,
It is for
brilliant,
both.
perfect.
We are not doing the segregation thing
Oh
anymore.
my
Boys
goodness,
and
yeah,
girls need to, look, my son is 4. But when he was 3, he came into the bathroom and he saw me changing my pad and he noticed blood on it. And he asked me, and I just said, matter of fact, mommy has periods.
yep,
It's just one of those things. And he said, oh, okay. And that was it. And no,
yeah.
actually, he said, am I going to have it too? I said,
Yes,
no, don't
I
worry.
think we've had a similar conversation in our house.
And then hugged me and he
Yeah,
went about his way. So he knows that he knows about periods.
yeah,
And it was just a matter of fact conversation. By the way, as I'm sure you have kids, they just walk in, they walk into the bathroom like,
yeah,
I'm the king of the house. I can do whatever I want. But ultimately, the point I'm making is that even me growing up, even having the conversation, it was just, you don't say it out loud. I'm Muslim as well, and like during Ramadan I would pretend to fast when I was on my period because I didn't want anyone to know that I was on my period. And people are still doing that
yeah.
to this day. Loads of women do that to this day. I did a post saying, please don't pretend to fast. There's a reason you're not supposed to fast on your period, for nutrition, replenish yourself with the water, so on and so forth. It was supposed to be a good thing. And loads of women said, you know what? You're right, or thank you, or actually thanks for speaking up about this. And it's a thing.
Yeah.
Periods are so taboo. They're so taboo that it was, I think, 1985, which I can't believe was 40 years ago, because it's 10 years ago, okay, 20 years. But 40 years ago, Courtney Cox was the first person to say the word
Yes.
period on TV with a tampon ad.
Yep.
And I think the first time that blood, actual red blood, and it was just a dot on the period pad, was on TV was in the late 2010s. And that was a big deal. It was like a big issue.
Oh, because it
Even
was always
showing
blue,
blood.
wasn't it? It was always blue. I remember the advert. Yeah, it was just a blue wash over the pad. Just bonkers.
Yeah.
Oh, it's mad. But it is so important. I think, I truly believe, I've got young kids as well, and I think it's one of the things, the segregation of health. We can't do that. Boys have to be as aware to empower women as much as they can empower men about men's health stuff as well. It has to be both ways. Everyone's in this together, so
Absolutely.
it can't be one or the other. Sorry, did you want to talk about your campaign? Dive in. Just tell us all about it.
Thank you. Okay, so last year around this time, I decided, do you know what? I'll tell you exactly what happened. I did a TEDx talk, and the TEDx talk was called "They're Not Bad Words: How Shame and Stigma is Costing Lives," and it was literally about around this topic. And we were given the option of having stalls on the day, and I was like, I have nothing to sell. And then I thought, you know what? Actually, I've always wanted to have a T-shirt that had the words on there. So that's exactly what I did, and I'm wearing the T-shirt right now. But they're not bad words at the front. And then at the back, it says, the back says vulva, vagina, and clitoris in the shape of a vulva. And it was just, again, my way of trying to break the stigma, change the narrative. The money from this goes straight towards funding menstrual health workshops in Sierra Leone, which we've had, and we're going to have a few more for the rest of the year. And what happens is that the girls are taught to make period pads, because in Sierra Leone, which is where I'm originally from, period poverty is a big issue, and there's still a lot of shame and stigma associated. So I talk them through anatomy, FGM, female genital mutilation is really big in Sierra Leone. So I speak about anatomy. I empower them with the knowledge about menstrual cycles, periods, why it happens, so on and so forth. Give them the opportunity to ask me questions as well. And then they spend about 2 hours making their own period pads. So we provide them the needle, the thread, the materials, everything. And then they go home with some of the materials so that they can make another one or two. And then we give them underwear. This is something that it was actually a colleague of mine who told me when she went to do something in her home country. A lot of the girls did not even have underwear to use period pads. So what we've done with the workshop is we've also given them underwear, 2 underwears. Plus we worked with Wuka, which is an incredible period pants brand, and they gave us one to give to each girl. So it's not just about empowering them with the knowledge and the life skills, see one, do one, teach one, and also give them reusable period pads. So I didn't want to just give them disposable pads and then
Yeah.
also ruin the environment at the same time. But I wanted them at least give them something that could keep for a long time. So the money goes towards that from the t-shirts. They're also made of 100% cotton because I didn't want to ruin the environment. They're good quality t-shirts. I'll send you one. But
Thank you.
ultimately that's what the campaign was all about. And then after we then this incredible lady wanted to support me. So she said, can I make like something for your campaign? So she makes these little cute keyring vulvas and little pocket vulvas, which we sell. And the
Love it.
vulvas come with little cards naming the different parts of the
Brilliant.
anatomy. And what's interesting is when I first printed out the cards, my daughter saw them and she said, Mommy, you forgot to label the perineum. I forgot to label the perineum. And I was like, wow. Now I need to reprint it. But someone said, no, have her print it out, have her handwrite it, which is cute,
Yeah.
and then pay her whatever the difference would have been to reprint the cards. I was like, okay. So it made it like a little cute family thing.
I bet you were very proud of that as well, that you got called out. You're like, oh my God, that's brilliant.
I was proud and upset at the same time. But yeah, it was amazing. And this is what we can do as a community. We can do this together. It was just a matter of fact thing for her. Like, Mommy, can you believe you forgot that? Like, sort that out. So that's the campaign, and I'm really proud of it because it's a lot of hard work and it's a lot of money from my end. But what I think is really beautiful is that anybody who's bought the T-shirt, who's bought the crochet vulvas, and also we had like gynae themed obstacle course. We're gonna have a couple coming up. It's basically you have to answer a question and then do a gynae themed obstacle to get through to the next round, and whichever team finishes, it's pretty cool. That that every time you see the menstrual health workshop, your money has gone into providing that, which I think is great.
It's amazing. That's incredible impact across the board. And just another string to your bow of normalizing and breaking all these stigmas. I was thinking earlier, you were talking about how much effort goes into just the social media videos. And I'm thinking, yeah, you're not an influencer, are you? You've got a real job. You've got the campaign. You've got to then, like you say, you can't just, something's come out. You've got to check it, double check it, make sure it's peer reviewed, do that, then make it make sense for all us laymen out here. And just the fact that you're doing all of this alongside all the other work, doing the ambassador work and your work as vice chair and your day job. Helping, I can't imagine how many people every day as a doctor. It's absolutely incredible. Before we get to we usually end on 5 questions. Is there anything, and I think the 5 questions will cover a large swathe of maybe some really helpful advice, but is there anything you're really passionate that you want to talk about that you think we haven't covered at this point?
What I always talk about is the need to know that you can advocate for yourself. I'm always say that because I feel like I hear too many sad stories that could have been different. And I encourage my family about this too. If you think that there's something wrong, nobody knows your body better than you. Please go and see a doctor and know that we are also human and we don't know everything. So if there's something that you think could be wrong, also voice what you think might be wrong as well. I'll say this as a GP. I'm looking at my laptop right now. You can see all the tabs. Literally, my mind is like multiple tabs open, like what it could potentially be. And sometimes you saying what you're worried that it could be helps to skew my mind, particularly if you're young. Because we do know that sadly, if you're young and a woman, you're more likely to be misdiagnosed and then more likely to have late diagnoses, because that's like, for instance, if we talk about cancer, it's not the first thing that comes to our minds for sure. And for good reason, because it's not that common, but that doesn't mean that it doesn't happen. And this is where I always say that nobody knows your body better than you. You're the CEO, the expert of your body. And if you are worried that something is wrong, see a doctor. If you feel like you're being dismissed and not listened to, see another doctor. And I have had people say to me, well, why do I have to do that? Why can't the doctor just be good enough to know and do things? And I hear you. There are things that we can be better at. But I also, this is again why I say that we are also human. So please, if you have to push, don't give up. Keep pushing. It is sometimes a matter of life and death.
It's definitely a two-way street, isn't it? I think, we want to feel heard as a person going in, but we also have to communicate in a way that you can hear us. Saying the right word, and this is all the work you do. It's so important. saying the right words to you. We had Dr. Anish Patel say exactly the same advice, which is lovely from two doctors. Say the word cancer. If you're worried about cancer, it will click in my head, and then that's there, and then we can work through that together. And I think it's really important to communicate. What have we got now? 7 minutes in a doctor's surgery. It's not much, that, and that doesn't feel like a lot for us to be heard. But also, you've got to sit there and do the mental maths of what do I actually think is best for this person. So we have that obligation to come in and make sure, symptoms diaries, absolutely brilliant for you as well. Like, this has been happening. This is not normal. This is my normal. This feels abnormal for these reasons. I get that you guys don't want us all going, here's 45 tabs on Google, please. Or ChatGPT told me I've got this. But empirical data and, feelings, and like you say, we know our body's best. So that's real. That's actually going to bleed into some of the questions. So you might end up repeating that one. But if you don't mind, we can dive into our 5 questions that we always ask. And I've tweaked yours slightly as your role. So, number 1, what advice would you give to someone who's worried they might have cancer?
So the first thing I'll say is breathe for a minute. Please don't panic, okay? If you are worried that you have cancer, then please don't delay. Give yourself peace of mind. Go and see a doctor, okay? Because a lot of the times we're sort of sitting on this clicking time, like it's in our minds. Even if we try to push it away, we're just constantly stressed and worried. Oh, it could be cancer, and then we don't get seen. Because there's also that, it's the funny thing that we do as human beings where, oh, I think it could be cancer, but it's going to really disrupt my life, so I'm not going to deal with it right now, or actually I'd rather not know. When really, if we had picked it up earlier, if it did turn out to be cancer, it's more likely to be curative, more likely to be treatable, and also more likely that the treatment is less invasive. So this is where it's really, really important that I would say see your doctor as soon as you're concerned that you might have cancer, and then also tell them, like we said, that you think or you're worried that it could be cancer and why you think that it could be cancer. Have that symptom diary, as you say, track your symptoms. And you don't be afraid to say that this is why I'm worried. And we shouldn't and we won't dismiss you. It's about exploring the different potential causes and at least having that in our mindset that, okay, this is what they're concerned about. Let's see what we can do to hopefully rule that out and then manage their symptoms as they go. I wouldn't stop people from going to Google, because Google it's a blessing and a curse, but just know that Google will always give you the worst case scenario. So don't over Google, but if you just want a little bit of reassurance or a little bit of understanding around things, and then do that. But don't just stick with Google, ChatGPT, any of those AI platforms and say, oh, okay, well, Chat said it's not, so I'm good.
Yeah.
No, see a doctor. Let's do the test, and then we can say it's not for sure.
100%. And I would say also a good intermediary, if you are concerned, can be charities as well. Even if you just need someone to prompt you along. I mean, we're always going to prompt people to go to the doctors and everything, but I think they can be good, maybe stepping stone intermediaries. I think you've given some amazing advice. My next question was about people talking to their doctors about cancer, like if they're for going into that actual doctor's appointment. But I think we've covered most of that. I think maybe the only thing I might add is something that I'm sure you advocate for as well, talking to people about family history. For doctors as well, really important, right? That, and again, normalizing the conversations in the family home, but you knowing that mum and grandma might have had X cancer or Y cancer helps you go, right, well, this might be a higher risk for me.
And it is really helpful to know what type of cancer it was that they had, because certain cancers that run in the family, often if they have this, say for instance, if you have a family history of breast cancer and you're concerned, then the likelihood, and then there are certain genetic conditions like Lynch syndrome. If you know that, okay, they've had these cancers, then maybe there's a possibility of that as well. But yeah, no, I couldn't agree more. Family history is extremely important.
Real, thank you. What advice would you give to someone recently diagnosed with cancer?
This is this can be really, like, it's a lot. I think what I would say is for people to allow themselves to take it in and allow yourself to go through the emotions. You're human at the end of the day, and it can feel really scary, especially from what you may have seen portrayed. And I think for the longest time, whenever people thought or heard about cancer, it was immediate mortality, isn't it? It's like, oh, it means I'm going to die for sure. But what's really great about a lot of the research that's out there, and because of people like you who have made it possible for there to be more funding into research and more research to be available, there are so many people who are literally living with cancer and they are thriving. They're living healthy lifestyles with cancer. So I think it's understanding that that is a possibility for you. I think it's also really important. Often when a diagnosis is made, everyone who's been in that situation, they usually say the same thing, that you don't hear anything anymore. It's like you just heard the diagnosis and everything else is gone. Just lean into all the questions that you have afterwards. Just write everything down that you're scared of, that you are considering, or what the treatment options are, whatever. Just, and also have your people there. Try not to do it alone. I think that's another thing where within my community, there is a lot of taboo around cancer, and they just leave it within themselves. Some don't even tell their really close family members. And this is where, again, people don't know their family history because nobody said. They said, oh, she just died, or they just died. So lean into your family, lean into the support, and lean into incredible cancer charities like Tribe Against Cancer. It's just, I would encourage you to do that.
Yeah, I agree. And and you talked about those grassroots, from the top, the Macmillans, all the way down to the grassroots. There's going to be a community out there for anyone, and I think that's it's an amazingly supportive community that you can find your tribe wherever you need to be. You can find the people that you resonate with, whether that's your cancer diagnosis or your community or your religion. There's going to be someone supporting out there. So
and accept the support. I think that sometimes can feel really hard for some people. Accept the help. I often say that, like, we are incredible human beings. Yes, we're superheroes, but even superheroes have a team, like the Avengers. Don't do it alone.
I love that. That's brilliant. What advice would you give to someone who wants to be a better health advocate for themselves and others?
Wow. I mean, the fact that they're even thinking about it, I think that's already a really positive step. I would just say the best thing that you can do is ensure, especially in this day and age where we're sharing a lot of information, if you're going to share something to whomever, just make sure that it's accurate. Always think twice before sharing things. And also, if it's too good to be true, then it must be too good to be true. I think that sometimes we make things complicated than they need to be. I often repeat the 5 things that can help to reduce our risk against cancer. So if you want to be a good advocate for yourself, then take care of yourself by doing these 5 things. Not smoking at all, not even vaping, because vaping has become such a thing. And actually, we know that causes its own lung disease. And I think in years to come, we're going to find out that it causes even worse things. But people vape, and people are in one sitting. I don't think people realize it's almost the equivalent of 100 cigarettes. It's bad. Please don't do that. Please, please, please. If you don't start. And then alcohol. This very much depends on who you speak to. Obviously, the recommendation is no more than 14 units across the week. I always say across the week because some people are like, oh, I'll just have 14 units in one weekend. No, don't do that. Across the week. But some people actually go as far as to say don't drink at all. Again, it's entirely up to you, but definitely don't go over the threshold that's been advised. Exercise. We have all become extremely sedentary. Like, a lot of our jobs are just sitting down. But we need to get moving. We need to move more. And and I think this is the other thing. Everyone's like, oh, well, I need to join a gym. I can't afford the gym. You don't need the gym. Go for a walk. Just go outside. Go for a walk for 30 minutes, or use YouTube videos online. You don't have to do anything extravagant to get your body moving. Any exercise is better than no exercise at all. And the recommendation is 150 minutes across the week. So that's 30 minutes over 5 days, or spread it how you want. Vigorous exercise, 70. And then they also say do strength training, and that's just really great for our bones and our muscles. And then make sure that you're having your fruits and vegetables. I cannot tell you how many patients I've seen who have low folate levels or B12 levels, and often that's dietary related. We're not having enough in our diet, and we can get a lot of these things from the fruits and vegetables, and whole meal things. So try and improve that, and then you'll notice a difference. And I would just, you can usually inspire people through your own actions, because people usually do what you do more than what you say. So try and be the role model advocate that inspires others to do the exact same. Yeah, that's what I'd say.
I love that. I think that all of that advice is brilliant. But that last piece, especially, and I've noticed this in my own life, and we hear it from our ambassadors as well, which is when you start opening up, when you start talking about these things, people have permission to do it themselves, and that is a very small little cultural shift in your little world. But that you just keep adding those up, and that's how you change things long term. I think that is, yeah, brilliant advice. Live like you live how you say to advocate. Absolutely.
Exactly.
People need that. So brilliant. Last question then is just, what's the biggest lesson you've learned from working alongside the cancer community?
Oh man, honestly, it's that we are a lot stronger than we ever realized. A lot of the cancer patients, people, advocates, just anyone who's gone through cancer, what I've always admired is just the strength, the resilience, and how I feel like they become really selfless because of what they're going through, and that realization that life is fragile. Like they say, you have a million problems until your health is a problem, then that becomes the only. I have learned to value health and life in general, and not putting things off, and knowing that tomorrow is there, but let's live in the present. I feel like nowadays, because of social media and all these things, we're living so fast. Everything is so fast paced and needs to be done, yesterday.
Yeah.
And whenever I'm with the cancer community, it's always the same thing. It's like, just live in the moment, and stop worrying. There's so many things that we worry about that in the grand scheme of things aren't really that big a deal. Yeah, and I'm always really inspired by everyone within the cancer community. My uncle was recently diagnosed with cancer, and he's a lot stronger and more positive, and just he's different since the diagnosis, and it's incredibly inspiring. And I really feel like that's playing a part in how well he's doing at the moment. Thank God. I hope it continues. So yeah.
Obviously, please wish him the best from all of us as well. I'm sorry to hear that.
Thank you.
But yeah, I think, that perspective that you get when you're around the cancer community is unique, and something you never want to take for granted.
Yeah.
Incredible. I'm going to sum up now. I'm going to try my best to sum up. I feel like my brain is exploding. We've talked so much about so many incredibly important topics. We've covered women's health, cancer awareness, health inequalities, mental health touched in there as well. And you said earlier, being the best advocate is leading by example. And I think you do that incredibly. You live that every single day. So thank you so much for everything you do for everyone. I say it is everyone because it affects us all on a global scale. Not just here in the UK. You're making an impact not only in your audience, but what you're doing and across the world, in Sierra Leone, and those, just changing lives, one conversation, one video at a time. Please keep at it. We need more.
Thank you.
And I'll end the podcast by saying I definitely need to send you a pair of balls, I think, just so you can add them to your repertoire. So I'll get some in the post to you. That's not normally how I end a podcast. But thank you so much for your time. It's been an absolute pleasure.
Thank you. Thank you for everything that you're doing. You are incredible. And if you guys are watching this, he just finished the marathon, the London Marathon. Yay!
I did. But I should actually, sorry, don't stop there. The last thing is, where can people find you? Because I nearly forgot that. So let's end on that.
You can find me. I'm Dr. Aziza Sesay on LinkedIn, but on socials, Talks with Dr. Sesay. And that is on Instagram, TikTok, YouTube, everywhere. Yeah.
We will put the links across everything, and thank you again for your time.
Thank you.
If you enjoyed this episode, please give us a review and follow us on social media at Thrive Against Cancer. And be sure to check out our other episodes wherever you listen to your podcasts and on YouTube. If you want to help support our mission to give a voice to the cancer community, please contact us or visit our website to learn more at thriveagainstcancer.co.uk.